Most people think brushing and flossing is only about keeping your teeth white and your breath fresh. But what if I told you your oral health could be silently affecting your heart health? In today's video, we're uncovering the truth behind the myths and facts about oral health and cardiovascular disease. Stick around, because what you're about to learn could completely change the way you think about brushing your teeth. When people think about heart disease, they usually consider high cholesterol, hypertension, obesity, or lack of exercise as the main contributors. While these are undeniable risk factors, one surprising element often overlooked is oral health. Over the last 2 decades, scientists have uncovered strong links between gum disease and cardiovascular problems. However, this subject has also become clouded by myths, misconceptions, and half-truths. Let's separate fact from fiction to understand how your oral health can affect your heart. Myth 1. Oral health and heart health are completely unrelated. Fact. They are strongly connected. For many years, the mouth and heart were seen as separate systems with little overlap. Today, research has shown that gum disease, or periodontitis, can increase the risk of heart disease, stroke, and clogged arteries. Bacteria from infected gums can enter the bloodstream, triggering inflammation in blood vessels and contributing to plaque buildup. This inflammation is a key factor in the development of atherosclerosis, a condition where arteries harden and narrow. While brushing and flossing alone won't guarantee a healthy heart, poor oral hygiene may indeed raise cardiovascular risk. Myth 2. Only people with severe gum disease are at risk. Fact. Even mild oral problems can have an impact. It's easy to assume that only advanced gum disease is harmful to the heart, but studies suggest otherwise. Gingivitis, the earliest stage of gum disease, causes bleeding and swelling of the gums. Even at this stage, harmful bacteria can enter the bloodstream. Over time, chronic low-grade inflammation can put extra stress on the heart and blood vessels. This means that maintaining oral hygiene, starting with daily brushing, flossing, and dental checkups, is vital at every stage of life, not just when major problems appear. Myth 3. If you don't have cavities, your heart is safe. Fact. Cavities and gum disease are different issues. Cavities occur when tooth enamel breaks down from acid-producing bacteria, while gum disease affects the soft tissues and bones supporting the teeth. Gum disease, not cavities, has been linked to heart problems. Someone can have perfectly cavity-free teeth yet still suffer from gum inflammation that threatens cardiovascular health. The takeaway? Don't rely on cavity-free dental visits alone as proof of oral wellness. Gum evaluations are equally important. Myth 4. Treating gum disease can cure heart disease. Fact. It lowers risk but doesn't eliminate it. Treating gum disease reduces inflammation in the body, which may, in turn, decrease cardiovascular risk. However, oral care is not a substitute for other heart-healthy habits like managing cholesterol, exercising, or eating a balanced diet. Think of oral health as part of a larger prevention strategy. A person with healthy gums may still develop heart disease if they smoke, consume a poor diet, or live a sedentary lifestyle. Likewise, someone with gum disease can improve heart health significantly by combining dental care with traditional cardiovascular prevention strategies. Myth 5. Good oral hygiene is just about looks. Fact. It's about lifelong systemic health. Brushing, flossing, and regular dental checkups are not just about fresh breath or a confident smile. They are crucial for reducing harmful bacterial load and keeping inflammation at bay. Oral infections can silently affect other organs, including the heart, kidneys, and even the brain. Recognizing oral health as a medical priority rather than a cosmetic one is essential in preventing systemic diseases. Why this matters? Heart disease remains the leading cause of death worldwide, and gum disease is one of the most common chronic conditions across the globe. Roughly half of adults over 30 show some signs of gum disease, yet many underestimate its seriousness. By understanding the connection between oral and cardiovascular health, people can take proactive steps to safeguard both. This means daily oral hygiene. Brush at least twice a day, floss, and use mouthwash if recommended. Regular dental visits. Professional cleanings and gum checks catch problems early. Lifestyle choices. Avoid smoking, limit sugar, eat a balanced diet, and exercise regularly. Monitor overall health. If you have diabetes, hypertension, or high cholesterol, pay extra attention to oral health, as these conditions often interact with gum disease. The link between oral health and cardiovascular disease is real, but it is often misunderstood. Gum disease does not directly cause heart disease in the same way smoking or high cholesterol does, but it creates conditions, chronic inflammation and bacterial spread, that make cardiovascular problems more likely. The truth lies in balance. Oral care should be considered an essential part of overall health management. By debunking myths and embracing facts, you can take meaningful steps toward protecting both your smile and your heart.